What I'm going to show you here is how to set up for the forced vital capacity test. First of all, we'd come in here, and what I did before in the previous video is to click on New Study. That's when I called up my new patient. I typed in their name, FARLIS, and then I did a find, called them up. Here's my study 92617. I'm going to retrieve patient data, F3. If you see, all the data came in right there, and then as you heard in the previous video, I went through and I did the address, verified the address, the diagnosis, their medications, symptoms, all the symptoms, and left it at that, and then I stored the results and filed, which will take me to the main menu. We've already done the new study. So I called my patient back up. They had been in here before. So now we're going to do pulmonary function testing. I've already done the flow calibration. So new study, patient demographics, PFTs right here. This brings up your PFT menu. So the first one we're going to do is the flow volume loop. There's a couple ways of making sure it's on the baseline. If you're doing a pre and post, you need to make sure you designate whether one's a pre, one's a post. If you're not doing a pre or post, it is a baseline. For the purposes of our lab, they're always going to be baseline studies. So once we do that, we click on which one we want, which is going to be the flow volume loop. This is where you do the forced vital capacity. And our menu comes up like this. As you can see, we have no test results, no anything. So what we're going to do is ask our participant. We're going to start the test, and once we start the test, I'm going to have her take a few normal breaths to get comfortable on the mouthpiece, then a big breath in and explode it out. Okay, if our participant would go ahead and put their mouth on the mouthpiece, I'm going to hit F1 to, okay, you comfortable? You ready? Okay, I'm going to hit F1 to begin the test. Okay, breathe normal. Wait for it to show up on the screen so we have a tracing. Okay, once you take a big breath in and explode. Blow, 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 blow. Push, 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 push. Squeeze, 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 squeeze. Big breath in. As you see, we did hit all the way to the red line. And I end the test. At the bottom it said, end of test criteria not met. If we could do this one more time, if you would not mind. We're going to do it one more time. You saw the red dotted line on the right-hand side. I want to encourage them to blow all the way to there. End of test criteria may not have been met because maybe she's still blowing some gas out, squeezing it out. There's a lot of reasons, but remember, the computer is only an idea. It gives you prompts. We are the first line of quality control and can override the computer. Typically, I will say override the computer because you can always throw out the test after. So what we're going to do is do the test again. Okay, I'm going to try to squeeze a little more out of her. Normal breath. Start the test. We have a tracing. Okay, big breath in. And blow. Blow, 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 blow. Push, 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 push. Squeeze, 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 squeeze. Come on, get still going, still going, still going, still going, still going. Squeeze, 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 squeeze. Big breath in. Good. Okay, and then I'm going to come over here and end the test. Okay, this says end of test criteria not met, but as you can see the green on the bottom, it did meet the end of test criteria. It did prompt me for that. What it's saying here is the best peak flow and the next largest vary by more than 10%. Remember, they need to be within 10% of each other, and the 150 on the FVC and the FEV ones. But what I'm going to do is this F1 is reject the results. I'm going to accept them. I can always reject them later. And I'm going to escape on that too. See, what you're seeing here is the FVC. Looks like it's within almost 10% to me. It's about 30 cc's off. Well, 10% her lung volumes are small as far as the 3.2 liter, 3.326 liter. So that could be 10%. But this is where you review your results. I think they're pretty good. That's how you run the computer portion of the forced vital capacity.